Good day, viewers. Welcome to a new edition of 30 Minutes, the interactive program of Trust Television with me, Manir and Ali. Our guest today is a medical practitioner who studied in Bulgaria, that is in Eastern Europe, and has worked with the World Health Organization, WHO, here in Nigeria for more than 10 years, and is currently the executive director of the Sokoto State Primary Healthcare Development Agency. I'm talking about Dr. Larai Aliyu Tambuwal. Dr. Larai, welcome to the program.
Assalamu alaikum.
Sokoto of recent has been in the news, yes, pertaining to your area of work, health. There have been reports since late March,
yes,
into April, and I don't know what the current situation is, that there has been some strange ailment, some disease that is not very well known. What exactly is the current situation with that now?
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum to our viewers. Really, the rumors you had or the reports that you have been getting about a strange disease, which some other people call unknown disease, is true. Sokoto State in early March have experienced an outbreak of some strange disease which have not been seen before that time in Sokoto. Or rather, I would say it has not been reported like that in Sokoto.
Is that the reason why it's called strange or unknown? Because yes, I thought medicine knows almost
yes,
every
once you
disease
have not investigated and established the etiology and the clinical manifestation of certain conditions, you cannot immediately say what those diseases are. So a similar disease happened last year in Zamfara State, and some cases were reported in Sabon Birni and Isa of Sokoto State, but they have not been investigated. So since that time, it has gone down and nobody cared again. And recently there has been transition in government. So before people took up offices and start acting in their areas, we started seeing this disease again. This disease is characterized by gradual abdominal swelling.
The stomach gets distended.
Will get distended,
right,
and with what we call ascites, as per medical condition.
What's that ascites?
That is a collection of water inside the abdominal cavity. It can be from various types of diseases, ranging from poisoning with heavy metals, liver disease, and so on and so forth. So we started seeing these cases. Children are mostly affected, from 1 year to 10-year-olds. But we see sporadically cases of adults
as
coming down with the same kind of condition. So, and it was associated with pain in the heart, abdominal pain, and also lethargy. Those children, they are weak, they cannot even sit, and some of them were even vomiting. They could not retain food when they eat it.
Were there fatalities? Did people die from this disease?
Yes, some of them died, at least 3 that I can say. At least 3 children have died from this disease. And I was thinking because maybe they did not report very early so that they can be given some at least symptomatic treatment. And
also there could be the suggestion of people who even never got to the hospital, who may even have died because they,
yes,
a lot of people,
yes,
the hospital is not their favorite destination.
First of all, this disease is unknown, or rather the condition have not been seen earlier, and the people did not know what to do. And majority of our rural populace, they don't have this good health-seeking behavior. It is when they try the traditional methods, and if they fail, that is when they now start coming to the hospital. But most of the time, if they try traditional methods and they succeed and they are getting well, they don't even report to the hospitals. Whatever we see in the hospital is just the tip of an iceberg. So that is one of the reasons, maybe, that some of them even died before reaching the hospital.
It's interesting you mention Isa and Sabon Birni, yes, which also happen to be the areas in Sokoto State that are affected by a lot of insecurity. Some of, yes, the areas are more or less ruled by bandits like Bello Turji and what have you.
Yeah.
Did it have any connection with that, or
well, really,
the insecurity?
Ab initio, we were thinking maybe it is the bandits that are poisoning the waters. We were also thinking of extension of the mining products down the river line from Zamfara state where illegal mining is occurring. So we were thinking of actually poisoning with heavy metals, but we could not determine it from the beginning. And then it kept extending from East Sabombini, it is now in Ilela. And we are beginning to see sporadic cases from within the towns that are not at that extreme end, like Tambuwal and Bodinga.
Which are completely in different areas.
They are different area. But most probably those people travel to those sites and they now travel back and they were spotted now in these internal areas. So when we saw that some of the cases were bad, so they were referred to the general hospital Isa before they were now transferred to specialist hospital Sokoto for adequate management. And that was why when we heard about it, the Honorable Commissioner, who is the chair of the committee that was created to go and investigate this matter and report to His Excellency, she swung into action. And from the preliminary information she got, she made a call to His Excellency while he was in Saudi, and he gave her the go-ahead, and they gave her a squad of army to collect all the stakeholders and go to that Isa Sabombini and visit the victims and see the situations there and try to elicit what was the reason behind all
So she was given heavy security cover to be able to visit the area, because the area is more or less ungovernable.
It's so insecure, and the insecurity situation is so fluid, because today you can go there and pass normally and come back, but tomorrow you may hear that the bandits have blocked the way and they are killing everybody that comes there. And
I recall, is that area where maybe about a year or a little over a year ago, a whole bus
was burnt.
And everybody on it was put on fire, and only their charred remains were found.
That is true.
The situation is that bad.
That is true, because the bandits more or less rule some of those areas, and they give instructions, which if you don't follow, they will do anything they want to do to you. So people are scared to go there. The people there, they are scared to come out. You know, it's not frequent that you see somebody just pick their car and just go there. But when they want to access...
Yes, exactly, the assessment.
Yes.
The commissioner went with the security cover. They are able to assess.
We have the indigenous people that are working there.
Right.
And some of the health workers posted from the state level that are normally staying there. Maybe the bandits are used to them. Maybe they are even treating their families without even knowing. So they don't touch those people. But if you, as an outsider, try to access that place, you may come across them and they will be merciless. So that's why people are afraid to go there. But at least we are getting some of the information, and then we are depositing some of the medications and then the supportive logistics that the governor approved to be moved there to support those communities.
Have you been able now to determine exactly what sort of disease is it? Is it something to do with the metals? Is it something else? Could it be some lead poisoning, or could it be something else?
Yeah, I told you that some of the cases started late last year, but they were not investigated properly. But this year, with this event, the NCDC, Director General...
That's the National Center for Disease Control.
Right. Nigeria. The DG visited Sokoto State. He paid courtesy call to His Eminence, the Sultan of Sokoto, Alhaji Saad Abubakar III. And then he also paid courtesy to the Deputy Governor, who is the Chairperson on Immunization Task Force, as well as other PHC services and related health matters. So, in fact, the Deputy Governor was key in providing those, the security cover for them to go a second time and visit the communities where the incidents happen. And they took with them teams of experts and logistics to support the communities. The team of experts, those ones that will collect samples from the children affected, their blood samples or any other samples, then the soil and water samples, and inspect the environment. They even took the veterinarians with them to see whether the animals are also, affected, so that the holistic care can be provided. And from the preliminary, though it is not concluded, preliminary investigation is indicating towards lead and arsenic poisoning. And this could be resultant from the extension of the waters from the Zamfara illegal mining communities.
But in those areas, both Isa and Sabombirni, there are no such informal, what we call illegal mining activities going on.
They have not detected such so far.
And there's no history of that in that particular area,
well,
which is probably why you are pointing at Zamfara.
Yeah, we have not had that evidence coming from there. So we only know that it could be extended from Shinkaipi, Maradun, and thereabout, coming down to the waters, and well, it could have been the reason. The situation is still under investigation. I do not want to conclude anything, but these are the things that we know for now.
But it's interesting that all this is happening when it is not raining.
Yes.
Because you will assume that it's when it's raining that those lead, those heavy metals could be washed and flow into the water sources in far off areas like Isa and Sabon Birni. So what could explain that? Or is it the residues, could it be residues of previous rainy season? How do you imagine?
You know that the rivers are there permanently.
Okay, they are all season.
Yes. Sorry, whether they are full volume or low volume due to the variance of the season.
Right.
They may be fuller now that the rainy season have started, but they are there permanently, and the water keeps flowing. So that's why even our own, perception that it may be from those waters that are extending. And some of them also, take waters from shallow wells, and we are also thinking of the downward sinking of those heavy metals into our shallow wells, and the people are collecting and utilizing them.
When are we likely to have a definitive result of all this? Because while it's taking time to do all this, people are still living there and probably still taking the same water if water is the source of the ailment.
Yeah, really the NCDC is on top of the matter. WHO is also on top of the matter, together collaborating to see that a definitive diagnosis is established. Because you cannot just due to assumption, but you can say due to experience and previous knowledge that this thing is in flow with certain diagnosis. But you cannot definitely until you see that sample is processed and also the diagnosis is brought out, the laboratory part of it, and which will complement the clinical part of it. Now, there are 2 labs, and they said the one we have in Africa and in Nigeria for analyzing those kind of sample is in Sokoto, and also it has some logistics issue, but the DG...
That is, maybe it's not working properly.
It's not working properly. So the DG have actually asked the Honorable Commissioner to go and find out and document whatever is missing there so that he can bring out support so that whatever case is brought is easily processed, and then the diagnosis is brought out.
But has there been any communication with your neighbors, the Zamfara government? Because if you are suspecting that, shouldn't you give them a head start, a heads up, so that they also watch their own end? Because I assume that the illegal mining is still going on. Yeah,
the surveillance system, is a holistic one for the whole country. That's the IDSR, the Integrated Disease Surveillance and Response System. And we are in communication with our neighbors and all other parts of Nigeria. There are times when we see cases in Sokoto, but those cases belong to Oyo State. We quickly call the disease surveillance officer and hand him over with the full details of what we have been doing or what we have done so that he can continue from where we start. Because we don't keep quiet, and diseases will spread among the community members. So we are in communication with Zamfara State, and whatever other information they have, more than what we have, we collaborate and we educate each other, and we correspond in all the times.
Very good point at which to go on a short break. Viewers, it is 30 minutes, the interactive program of Trust Television, and our guest today is Dr. Larai Aliyu Tambuwal, a public health practitioner, as well as the Executive Secretary of the Sokoto State Primary Health Care Development Authority. Welcome back. It is still 30 minutes, the interactive program of Trust Television, and our guest today is the Executive Secretary of the Sokoto State Primary Health Care Development Agency, Dr. Larai Aliyu Tambuwal. Doctor, you were talking about the heavy metals challenge, which you suspect, at least at the initial stage, of being responsible for the strange disease, the strange ailment, the unknown ailment that appear to be ravaging parts of Sabon Birni and Isa local governments of your state. Let's come to the state capital, because aside from that issue of unknown disease, Sokoto is also one of the areas that is giving the federal health authorities and even the WHO and other stakeholders concern, because they still see that in the area of polio and some of the other immunization that is supposed to happen, Sokoto seems to be having issues. Why is that so?
Well, in the area of immunization services have been going on since 1996 in Sokoto State. Some of the activities had been conducted over this period of time, and some are new. While we are all leveraging on the Global Polio Eradication Initiative, which calls for strengthening routine immunization so that at least 85% of the targeted children are vaccinated with child vaccine preventable against the vaccine preventable diseases, and then we supplement some of the antigens to them until to the certain age. And then we also conduct surveillance of disease to ensure that we detect AFPs, which are a syndrome that is indicating towards polio infection. And then
that is the same polio that we've been told has been eradicated in Nigeria. Is still some variants of it is still available?
So because that Global Polio Eradication Initiative is after wild polio virus, the three types, type 1, type 2, and type 3, and other similar viruses. So among the other similar viruses, though we have eradicated the wild polio virus, and Nigeria saw our last case in 2018, and we were given the certificate of eradication in August
of that
2020. No, that is 3 years after the last case was seen. That's the condition. You must see the last case at least 3 years back before you are given the certificate. So we were given that certificate. But unfortunately, we have those other type of polio viruses, the circulating vaccine polio-derived viruses, because the oral polio vaccine that we administer is a live viral vaccine. And it replicates in the guts of the children that are given, and it provides more immunity. But unfortunately, when there are conditions that allows that virus to be shed in the stool sample, it goes into the environment, especially where you have indiscriminate open defecation, indiscriminate refuse disposal, including feces and other things. So it will go into the environment and mutate. It will have change. Other characteristics that if somebody by coincidence swallowed food or water contaminated with this polio vaccine that is swallowed by the child, it will be like you have given a polio vaccine to that child. It will boost his immunity. But if it has mutated, it will behave similarly like the wild polio virus, and it will cripple the child because it goes after the bone marrow and affect the anterior horn cells, which are responsible for movement. And that child, anywhere that is affected, the nerve coming from that side into the hands or into the legs or into the rib muscles that help us to respire, it will paralyze them.
So it still has big dangers.
It has the same danger like the wild polio virus. And that is why our fight have not finished. And we have to continue to vaccinate using the routine immunization, using the supplementary immunization activities, while we put our eyes out in surveillance to see if we can see anything polio or similar to polio. And it will gauge our own response to it.
You mentioned open defecation. Even here in Abuja, there are places where you have to hold your nose when you are passing. It's still
very rampant.
What can we do about it?
We have similar areas in Sokoto State where the some of the inhabitants of those areas near our sewage system, where we have open gutters collecting waters from all the areas of the settlements, they have their pipes from their toilets direct into the gutters. And when they now put out those excretions, they come into contact with community waters, animals, and children that are playing around. And even some where the pipe-borne water is broken,
yes, and then
it can contaminate our water.
Yes.
So we see the spread of these viruses, and majorly it affects the children that have less immunity. Because if you give the child routine immunization from birth to 1 year, that child is supposed to have at least 3 doses of polio vaccine.
And when you mention this routine immunization, it's good to break it down.
Yes.
You mean immunization against all the different childhood
yes.
diseases,
including
6
the
or 7
polio
of them.
vaccination.
Yes.
Including the polio
yes.
vaccination.
You are talking about whooping cough.
Yes.
You are talking about what other ones?
Hepatitis,
you are the doctor.
Yes. Tuberculosis, all other vaccine preventable diseases that we call them childhood killer diseases. Those ones that we have vaccine against them. So we have a schedule in Nigeria whereby you provide these vaccines from birth, 6 weeks, 10 weeks, 14 weeks of birth, and at 9 months. Now we even open it up to 2 years, so that the polio injectable vaccine can be given additionally at 14 weeks and at 24 months.
But still there is a lot of skepticism. I know it's gone down.
Yes.
And especially up here in the north and probably very strong in Sokoto.
Yeah.
There are still some, what do they call them? The
non-compliant.
Yeah, the non-compliant, the
yes.
anti-vaxxers, as
yeah.
they call them elsewhere.
Yes.
Because even in America, there are people who don't want to take vaccination.
Really, the social media and other people that go underground and create negative messages for vaccination are causing a lot of trouble. Anybody who is, I will not say only the religious people, anybody who is sensible knows that the smallpox, which was ravaging people, is no more available. The goiter is no more among our community members. And then measles have gone down also because of vaccinations. So if you are now waking up today and somebody is telling you the vaccines are there to reduce your fertility so that they will reduce the African population, that person is just lying to you. Some are even saying that the vaccinations are there to impute into you HIV infection. We have been vaccinating people for the past 40 years, and it has not been proved that it causes this HIV or lowering of the fertility.
But there are still gullible people. Now one of the new issues is the HPV vaccine, that's the human papilloma virus, the one that causes cervical cancer.
Yes.
It's available for girls, but
yes.
already there is controversy about it.
Yeah, the education and also the knowledge in healthcare is always evolving. When you find new facts and also new medications and vaccines, you introduce it to the population. But a lot of people create rumors, like I said earlier, misconceptions, and attach them to either culture or religion, so as to prevent people from getting the benefit of those interventions. But like this HPV vaccine now, people are rumoring. They are even creating, voice notes and sending out that it is to make the girls infertile, so that before they are now mature, they can no more give birth to children. It is not true. Even polio, people said that. But I believe you me, today the girls that took the polio, they are the ones having multiple births even. There is even more births, more deliveries than before, because people are becoming healthier, people are becoming, more versatile in their economic and their health perspective. So this one that people are saying 9 to 14-year-olds are given HPV vaccine just to kill them, to stop them from being fertile, it is not true. It is to prevent the human papilloma virus from infecting them before it infects them. That is before they become sexually active. We want to prevent that, because the human papilloma virus exposure is getting more from sexual intercourse.
But some are exactly hinging on that and saying, look, it is just to make our girls amorous, to be having lots of sexual partners, to make them go against our religious beliefs.
No. That is not true. That is not true. In fact, we are targeting girls that have not even commenced sexual intercourse, so that they have not been exposed to anything, so that they can have preventive measure even before they are now legally or illegally exposed to sexual intercourse, so as to prevent, because cervical cancer and breast cancer, they are the two leading causes of death among women. We have other causes also contributing to the overall mortality among women, including maternal mortality due to pregnancy and childbirth, but these two cancers have been seen to be leading in killing or making our women morbid, that is making them sick. And especially breast cancer is amenable to early detection, because the woman can even examine herself and know when she has some signs and symptoms pertaining breast cancer. But cervical cancer is hidden. It only, come out when it is very late. So it is better for people to collect the prevention and, cross their fingers and continue to pray and do any other thing that they are supposed to do so as to prevent themselves. Because the death, as we Muslims believe, it has time. When your time comes, you must go. But it is suffering that is not welcomed.
On a final note, before we wrap up, we just have about a minute.
Yeah.
What will you say are your biggest challenges being the person in charge of primary health care in one of the most conservative states in Nigeria, Sokoto?
Yes. I'm happy you said this conservative, because people, come to Sokoto and say people in Sokoto, they are so strong-headed, they are non-compliant, you cannot educate them. No. Sokoto is the city of knowledge as far as I'm concerned, because the daughter of Usman Danfodio, Mama Nana Aishat, Nana Asma'u,
yes,
she was the pioneer of all this education and writings, particularly on Islam and Islamic jurisdiction, and also guiding people towards doing what is right.
But is that tradition still there in Sokoto? I mean,
it is.
Look at how far was the daughter of Usman Danfodio, Nana Asma'u, alive?
It is.
18 something.
It is.
Is this still the case? Are there still women who...
We are some of the trailblazers that she left. So what I was going to say, yes, people in Sokoto, they are conservative because they are knowledgeable, and before you can convince them, you have to bring a convincing evidence.
So superior knowledge is what?
Superior knowledge. And you also have to come through their culture and their religion before they take anything they are introducing to them. They are not just people that you meet and say, come and do this, and they will follow you and do it. You have to explain to the best of your ability. You have to provide all the evidences that will make them to believe that, yes, this thing is good for me, this thing is not going to cause harm for me or my family. And we listen to our community gatekeepers, the traditional institution, the religious institution. And if you don't go through these structures, whatever you bring, even if it is money, you are less likely to succeed in making people to accept it. So we are actually going through them, sitting with them, explaining to them the essence and even everything about anything that we want to introduce. And we have acceptance, and we are trying gradually to go into the community members and bring them forth, dialogue with them, tell them, allow them to ask questions, because that is their right. And
very
that is what we are doing.
Good point to end the interview.
Yeah.
Thank you very much, Dr.
So
Larai Aliyu Tambuwal, for coming on this show.
Thank you so much, sir.
Viewers, that's the end of this edition of 30 Minutes. Keep a date with us.